Good morning. It is Monday, March 13th. I'm Jessica Lovell, and welcome to the Morning Medical Update. The sound of my voice, the colors on your screen, the taste of your breakfast all runs through your brain. Billions of neurons all bundled together control your senses, your body, your emotions, memory, and of course, so much more. It is complex. It is mysterious. Today, we are talking with experts who have devoted their lives to understanding what is going on inside our heads. And we are giving you the chance to kind of pick their brain. Make sure you get your questions in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. But let's first get started on this Monday with our morning rounds. Dr. Saurav Luthra is our sleep medicine specialist here at the University of Kansas Health System. And Dr. Luthra, right off the bat, we lost an hour of sleep over the weekend. But the question is, does daylight savings time bother you as much as it seems to bother the rest of us?
Yes, I think it bothers all of us, and as a sleep physician, a lot, because we have been talking about this for years, where we are saying that this is quite unnatural to shift the clock 1 hour, because our internal biological systems do not move like that. And so you would move the clock 1 hour, but you haven't finished your sleep. Your internal biological systems are not aligned to that timing. So there is increased risk of health issues as well as social issues with this shift in the time.
So it messes with our circadian rhythm a bit. So how do we adjust that?
So, eventually in a couple of weeks, it will automatically adjust because you will be sleeping and waking up with the new clock. But in the first couple of days, you could take an extra nap in the daytime if you're feeling tired. You may plan to get an extra hour at night before the time changes. And then just try to get a lot of bright light during the day to help with the transition.
So let's talk sleep and the brain. There's some research showing that your brain kind of cleans itself while we're sleeping. What does that mean, and why is that so important?
Yes, so some research has shown that the brain does, the sleep does help in brain cleaning up the toxic chemicals such as the beta amyloid and the tau protein when we are sleeping, especially in the deeper stages of sleep. And these proteins, when they are not cleaned, then deposit in the brain and can lead to the formation of tangles and plaques, which are seen in problems like Alzheimer's.
So what do you want people to know about sleep in connection to our brain health? What's important to know?
So sleep is extremely important for brain health. We can think about sleep helping us in our memory formation. When you don't sleep, your mood is not great, so it's also important for maintaining a healthy mood. Your cognitive functioning, that includes your attention, your focus span, etc., are also derived from a healthy sleep. And there is increased inflammation and oxidative stress in poor sleep that can further down the line lead to neurodegeneration. So sleep basically is important for a healthy brain.
Dr. Luthra, always great to have your insight. Thank you so much for being with us this morning.
Thank you.
Joining me now in studio are two medical doctors, brain experts, and chair of their respective departments at the University of Kansas Medical Center. Dr. Paul Camerado, right here in the center, chairs the Department of Neurosurgery, and Dr. Gary Gronseth chairs the Department of Neurology. Gentlemen, thank you so much for being here. You're also great docs here at the University of Kansas Health System. So there's a reason why you're here to talk about the brain. Also, we are joining, we're actually live this morning from Stowers Institute for Medical Research, Dr. Cossack C., a neuroscientist and the scientific director there at Stowers Institute. Dr. C., how are you?
Fine, good morning.
Hey, good to see you. Good to talk to you this morning. We're looking forward to this conversation. Most people don't really think about the brain until something goes wrong, like a concussion or you have some sort of mental health issues. Let's talk about dementia and Alzheimer's. There's research showing proteins in our brain play a role. Still no cure, as we know. But Dr. Gronseth, what's your take on the current Alzheimer's drugs that promise to slow memory loss?
So these drugs are designed to remove one of those toxic proteins that was already mentioned, amyloid. So there are antibodies that attach and remove it from the brain. And the study showed that it's very good at that. Now the hope is that'll translate to a clinical benefit, and the study showed that there's a small clinical benefit. The hope over the long run, if you start it early enough and take it long enough, that we'll see a bigger benefit. But we need longer trials to figure that out.
So, Dr. Camarado, you're a neurosurgeon. Still no surgery to fix dementia, but you're hopeful for an Alzheimer's cure one day. Where are we looking down the road?
Yeah, so that's a really good question, Jess. As a surgeon, really, we don't have much to offer. There are some experimental trials where there's a branch of neurosurgery called functional neurosurgery, which really deals with the function of the human organism. And so we're trying to improve some of the deficits that Alzheimer's causes. There are devices that can be implanted experimentally to improve memory, because that's the major deficit in Alzheimer's. But yes, like everyone else, we're certainly hoping for a cure sometime in the near future.
Dr. C, a lot of your research there at Stowers focuses on memory. And here's just a simple question, and I'm sure the answer is quite complicated, but what is memory?
Yeah, actually, that's a very interesting question. So memory is essentially brain's ability to reconstruct the world around you and create an internal representation of that. And what I mean by that is brain is not really a tape recorder. It's not recording exactly what's going on. It's creating a representation of what is going on. And the memory is essentially then brain's ability that in future, when you encounter something that is similar, then recall that information that's stored inside the brain. So that's in essence what it generally will think about memory, both in human and in other animals.
And Dr. C, has your research found anything interesting related to dementia?
Yes, and actually I think that's the joy and of basic sciences, because my interest was trying to understand how we make memories and how we hold on to them for a really long time. And what it turns out that the process, the fundamental process that actually involved in this creating a stable memory is actually involved formation of amyloids. Now we have been talking about amyloids for a really long time, that it is important for all this age-related dementia or other neurodegenerative diseases. So what it did essentially, it sort of forced us to rethink why brain makes amyloid, why amyloids are formed, and more importantly, what happens when amyloids are formed in the brain.
I want to talk about something else now that affects the brain, addiction, whether it be something as severe as drugs or even down to smartphones, whatever else there is that your brain is addicted to. Dr. C, how does memory relate to addiction?
The addiction is actually, at the end, is a disease of memory, because once somebody is used to drugs, and it is very well documented that even somebody stopped using drugs, they go back to where they first time encountered the drug, they will have actually the symptoms as if they are actually taking the drug or experiencing the effect of drug. So essentially the drugs creates an extremely strong memory of what happens during taking the drug and the subsequent events. So if we really want to understand and treat really chronic drug-related disorders, we really need to understand how we treat memory-related disorders.
Well, Dr. Camarada, in your findings, how does addiction change the brain?
Well, so addiction, involves the repetitive activation of certain pathways in the brain, and so the more times those pathways are activated, the more people tend to go towards that disorder. And so I'm not sure that there are actual there are biochemical changes, but structural changes in the brain probably don't occur.
All right, Dr. Gronseth, what could you add to that? Anything?
It's important to realize that addiction involves affecting the want system of the brain, and it's disconnected from the pleasure system of the brain. And so a drug that used to give you pleasure, as you become tolerant, you may not find it enjoyable anymore, and you know that it's associated with problems, yet you want to do it. You'll continue to do it. So that disconnect, I think, really has a lot to do with the problem.
What about bringing this up to my face all the time, even maybe not even thinking about it, right? Because we're all addicted to that. So it seems like there's something going on in there that we're drawn to. How can we train our brains then, Dr. Gronseth, to break those habits like the cell phone, even just the day-to-day things that might just be habits we want to kick?
So intentional practice. So yeah, you have to come up with a plan. I think it's easier to think about it when you think about somebody trying to stop cigarette smoking. There are certain situations where you're cued to smoke a cigarette. You have to be aware of those situations and have a plan of what you're going to do instead. Without that, it's hard to develop a new habit.
So I want to change gears now and talk, and Dr. Camerata, I'm going to start with you, of course, because talk about treating brain tumors as a surgeon. How do you treat brain tumors while limiting brain damage? And I want to talk about some options for people.
Well, so it depends upon what kind of brain tumor it is. Brain tumors are an abnormal growth of tissue in a certain part of the brain. And some of them have relatively well-formed capsules around them, others don't. Most brain tumors actually that occur in the brain don't have really good capsules. And the neoplastic cells, the cancer cells, go out into the surrounding brain. And so, you know, you can't remove every cell. I always tell folks I'm a carpenter. I can go in and take out the majority of it, but the little bits that have gone out into the surrounding brain, you really can't attack very well with surgery, because then you end up taking out a lot of the normal tissue. So you have to try and preserve that, and we have ways of doing that both in the surgical suite and also with chemotherapy.
Because we talk about, you know, invasive, non-invasive. Is there such thing as a minor brain surgery? We think of somebody going in for brain surgery. That is a big deal that you're messing with, but is there minor
Well, so like all other surgical procedures, they've become less invasive over time. So we can make smaller openings. We use little tubes sometimes to, just like they do in the abdomen or chest, small tubes or ports that we use to get through the skull and through the brain, so we don't have to damage a lot of the surrounding brain. So yes, there are minor procedures.
Well, and I'm not saying you've been doing this a long time or anything, but are you fascinated about how things have progressed, allowing you to be less invasive with patients?
Yes, it's really over 30 years. It's been a tremendous change, and it's exciting to see what the changes are for the future.
I've been doing some interesting stories lately, and one stuck out to me about a woman who had something going on, you know, in her spine and up towards her brain, where her, you know, personality changed. Dr. Gronseth, can somebody's personality change with some type of brain procedure or a brain tumor?
Absolutely. So the personality is a manifestation of the structure and function of our brain. So if you change that, you're going to change personality. A dramatic example is patients with intractable epilepsy who undergo a procedure where part of the brain is removed. Many of those patients have dramatically changed personality, and it's important to warn them about that and warn the family about that, because they'll be different people in many circumstances.
That is fascinating. Lots to learn there. Dr. Gronseth, you told us there was a shortage of neurologists. Is that true?
That's true. There is a shortage.
Why do you think that is?
So the shortage is manifested by, across the country, it takes 6 months to get in to see a neurologist. And it's for a couple of reasons. Number one, the changing demographics of the country. So people are getting older. When you get older, you are more likely to get brain diseases like dementia, for example. Along with that, people my age are retiring. We're becoming patients, and so the number of patients that need to be seen is increasing. Secondly, over my 40-year career, there's been an explosion in neurologic therapeutics. When I started neurology, we didn't have a lot of treatments. Now we can treat everything, which is a wonderful thing, but those treatments are complicated, and understandably, other physicians will refer patients with those diseases to us to treat them. And finally, I think there's been an underemphasis of neurologic training for non-neurologists. So all those things come together to really increase the demand on neurology.
Dr. Camerata, anything you can add with surgeons? I mean, it's such a narrow focus. I mean, people are really, really specified in their training. Anything you've noticed there? I'm sure you're always looking for folks to come help out.
Yes, we're always looking for neurologists to take care of our patients
always,
too.
Right?
The neurosurgery training program too is a bit long. It's 7 years, so it takes you know, a certain type of person to say, I want to devote 7 years of my life after medical school before I can start really working as a surgeon.
We just need a lot more Dr. Paul Cameratas.
No.
Yeah, a lot of people just like you. Hey, Dr. C, curious, what do you find most interesting about the way the brain works, just from a scientist perspective?
So the brain essentially working, so one thing about the brain we need to understand, which is absolutely fascinating, that brain is actually not seeing, hearing, or touching, or sensing anything. It sits in the dark, and all it receives is a series of electrical signal. And from those electrical signal is actually reconstructing the world for us. So in other words, if the brain cannot reconstruct, it does not exist. For example, I'm going to move my mouth now, but you wouldn't hear anything. But if you are a bat, you would have heard it. And the reason is that our brain, the change in air pressure, it cannot sense or cannot create enough signal for us to hear it, as opposed to a bat can. So what it does, essentially, brain gives us this enormous capacity to sense the world, do things, but at the same time, it can actually limit us. So that's what really fascinates me as a scientist. I think it's fascinating to everyone who exists.
Very much so. Dr. C, some of your work has also been in animals. What have you found when examining animals and their memories? Tell us more.
Yeah, so that's the thing. So as I said before, my interest was not trying to understand how we come down with these devastating diseases. My interest was trying to understand how we make memories. And as I said, the answer to that actually led us to the amyloids. And we found there are proteins that are different from the disease-causing one. They also form a structure that exactly like the disease-causing amyloids, but yet they actually help animals to form and hold on to a memory. So that raises a question then, when an amyloids become bad and when an amyloids become good? Is there a relationship between the good and the bad amyloids in the brain, and can it help us to approach these diseases in a completely new way, which we have not done it? Because so far, our attempts to treat the diseases was to prevent amyloid formation or remove the amyloids from the brain. So our results actually raises a very dramatically different possibility. Can we give brain the capacity to form good amyloids as we get old, and will it help us to form memories? I do not know that answer. If you are a fruit fly, I can say for sure, but for human, we don't know yet. But that's exactly where we want to go and we are going.
Dr. C, you don't know yet. We'll have to check back with you for sure. Okay, so here's a little fun we're going to have, because, right? That's why you're there. You're sitting there this morning. So we've learned there's kind of an interesting rivalry between kind of the brain and the heart, our neurodocs and our cardiodocs. And we want to ask some pointed questions that we got from some of the heart rivals over there. So they do heart transplants, right? They do them, right? Just like in a day. So why can't we do brain transplants?
Because if you did a brain transplant, you'd be doing a body transplant, because the brain is what makes you who you are. So that's kind of a philosophical answer.
Of course.
But the second question is more technical, and I'll refer to Dr. Kamaraj.
I mean, you can replace the pump in your garden pond, but the heart is a pump. You can't really replace the owner of the house. I mean, the seat of the soul. I'm sorry.
The seat of the soul. That is deep. I like that. So they have a medical device that can help the heart work, but is there a pacemaker for the brain?
Well, we've got several things that we put into the brain now that you might call pacemakers.
Okay,
we
tell
use
us.
them in functional disorders such as Parkinson's disease and tremor. We have these stimulators that are there to help ameliorate the tremor that folks have. We're using a device on the vagus nerve to help prevent seizures that delivers a certain electrical impulse that aborts the seizure. So yes, we do have sort of pacemakers light.
Okay, well, I'm going to check that one off. I will tell them that we got that figured out. Okay, so then they seem to have a complete understanding of how the heart works. Why is the brain so mysterious?
It's just a lot more complicated. I like to say that cardiology is to neurology as checkers is to chess. It's just a lot more complicated.
Okay, that makes sense. They kind of, both, okay. See, I love it. You put it in ways I can understand. Very interesting. Can we talk about the ties real quick? We can't.
Thanks, Gary. These are sweet ties. the brain ties.
The brain ties. Did he?
Brain Month.
I've never seen you in a bow tie.
Dr.
This is all his doing?
It's him. It's his doing. Yes.
I love this. I love this. Okay. Okay. We're getting some good community questions. You can ask your questions to all of our expert doctors and our scientists here today. Just go to YouTube, Facebook, or email us at the Medical News Network. Let's get to our other expert with our COVID count, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. Happy Monday.
Hi. I need my disease ties, actually. I need to get some of those. We do have those.
COVID tie.
Oh, that's right.
You do have stuff like that. You in a bow tie, that would be new.
Yeah. Well, right now for COVID, we have 50 total infections, 27 are active, so still, unfortunately, still quite high, 7 in the ICU and 5 on the ventilator, so a good proportion obviously here have severe illness, which is always a shame for sure.
So, Doc Hawk, you've seen a new study looking at people who caught COVID twice.
Yeah.
It appears immunity from the first infection helps during the second infection.
Yeah.
Just give us your thoughts on that.
I think this is good information. So it's from a lab. Dr. David Ho worked on this. He is one of the big HIV researchers back in the day, helped with treatment for that. Since the pandemic, one of his lab focuses has been on COVID, and there are other collaborators that he worked with as well on this. This is a preprint, and this just shows that people with past infections, even if it was Alpha or Delta, no matter what previous variant, if they are infected later on with an Omicron variant, they did seem to have a little bit quicker time to clearance of those viral particles, maybe by about a day. But again, this article is a preprint, so it hasn't been peer-reviewed just yet. They are also looking at just the cycle thresholds of the CT values of the RNA, not necessarily culturing live virus. But overall, I think this is good information. In general, as we continue to move through this pandemic, where people are having vaccine-induced immunity, but also infection-induced immunity, and we are starting to get to that higher level of overall population immunity, where less and less people are going to be severely affected. Obviously, there will be those populations such as age and other comorbid conditions, which are going to be disproportionately severely affected compared to other people. But this is just good information, I think, overall, showing that as a population, we are continuing to move through this, gaining more immunity to keep us healthier and out of the hospital for that as well. So,
Doc Hawk, thank you. Any reporters on the line today? Let's get to our community. A few good questions here. Sharon wants to know, Dr. Gronseth, do brain cells regrow or take over after a stroke?
We used to think no, but it actually turns out that there is some limited regrowth, and you can generate new brain cells. So that's good news.
That is good news. Dr. C, Aaron wants to know, how do I donate my brain to research? Well,
For that, I think you can contact any of the departments, for example, the KU Med neurosurgery department or KU Med Alzheimer department, and there is a very good process in place for that. And my research is really tremendously benefit from the generosity of people who are willing to share what the good doctor said, the self, because brain is who you are. So people are willing to share their brain, and without those things, we cannot really the work we do. So yes, there is a good process. Please reach out, and it's tremendously helpful to science to have access to the brain.
Joellen wants to know, how about brain fog, COVID and otherwise? What's up with that? So anybody, have we learned anything about brain fog and COVID and the brain? And
so it's a very nonspecific symptom that basically means you're having difficulty concentrating that, and we see that with any major insult, concussion, severe exposure to trauma. So it's very nonspecific, and we really don't know what it's directly related to in patients with post-COVID, for example, but there's a lot of research going on to try to figure that out.
Dr. C, do you do any research regarding brain fog?
No, because most of my patients, that is the animal, they do not tell me they're having a brain fog. I would love to know that. But I think it is just a general state of the brain, and it's very hard to know at this stage, what exactly going on inside the brain. But we understand what it means to a person, what they say they're talking about brain fog.
So how similar is a human brain to an animal brain?
Yeah, so clearly, our brain is distinct, definitely, because no other animal is sitting down and having this conversation we are having at this moment. So, but there are some basic processes, how two neurons communicate with each other, how they change each other. Those are fundamental processes that all brains, if they are made of neuron, must be utilizing some basic fundamental processes. And that's exactly what we see. Now, whether in our brain there's simply elaboration of those processes, or there are unique things that's going on in our brain is a question that we will learn over time. But if you are simply interested in understanding how we learn about something, how we make a memory of it, and how we hold on to it, and how we lose memories, how we fail to recall or remember, I think those fundamental processes you can go and study in a relatively complex brain. So just to give you a little sense of the complexity is also in the number. For example, a fruit fly brain has roughly 150,000 neurons. And in a mouse brain, there are millions of neurons. But in our brain, we have billions. So you can imagine simply the number games itself suggests that there are some unique things going on in our brain, and that is good for us.
Last question is going to be from Jeremy, and I'm going to ask everyone, but I'm going to start with Dr. Camerata. What's the most exciting advancement that you've seen when it comes to the brain during your career?
Wow, probably the most exciting advance has been the minimally invasive treatment of brain aneurysms. So when I was trained, we used to open the head, take off the skull, take a microscope and tiny little instruments, and put a clip on the neck of an aneurysm, which is a little blister on a blood vessel. And nowadays, almost all of those are treated without opening the head at all, just simply by going in through the artery, through an artery in your wrist or in your groin, up into the brain, and then treating the aneurysm from the inside. That's probably one of the biggest advances. Yeah.
That's a big deal. Same question to you, Dr. Gronzeth. What has been just a major advancement?
The way we treat acute stroke. So in the old days, patients would come to the emergency room with a stroke and they'd be put in a back room and people would just feel bad. Now a patient can come in with a devastating stroke and walk out the next day normal. It's a huge, huge advance.
Yes.
They both involve the similar, both my advance that I mentioned and his involve the technology, the catheter technology to get from here to there. And I have to say we owe a nod to our cardiology colleagues, much as I hate to say it, but they started this in the heart. And the neurologists and neurosurgeons took, okay, we can do this in the brain.
Okay, I will tell them you gave them a big warm,
kudos.
loving shout out today, for sure. Dr. C, as well, from you, just from a scientific standpoint, what has excited you? What has been just a big advancement that you've seen sitting in your lab?
Yeah, I think the biggest advancement is our ability to see, measure, and manipulate neurons has dramatically improved. We have come to that stage that we can record from the human brain the activity of set of neurons, and we can predict what the person is thinking. And if you think about it, that's really mind-boggling. What it means that one day, hopefully, we'll be able to read just all the electrical activity and figure out what is you were thinking, what you were imagining. And if that happens, it's just to me, just blow my mind away. It's just remarkable.
Well, thank you so much. It excites me to know that we'll sit here a year from now with the same panel, and there'll be more to talk about and more to share. So, because we're just constantly learning. I want to get to our final thoughts, and Dr. Camerata, I'm just going to start with you.
Well, just to say that I went into this 30 plus years ago because it was a vast frontier, and there was so much to learn and so many advances to be made, and it's still that way 30 plus years later.
Dr. Gronseth, final thoughts.
So there's lots you can do to save your brain. We've been talking about some depressing things like dementia and Alzheimer's disease. But the same things that you do to protect your heart will reduce your risk. So exercise, control your weight, control your blood pressure. That'll really help your brain.
Good tip. Good tip to walk out with today. Dr. C, your final thoughts today.
Yeah, I think we tend to focus on always the problems, but I think we should focus on the amazing capacity of the brain and what is a wonderful organ this is. I think this is perhaps, not to echo Woody Allen, I think this is the most important part of the human body, and we should really cherish it.
Absolutely. What did you call it earlier? The
seat of the soul.
The seed of the soul.
The seed
Oh,
of the
that is
soul.
just so lovely. I love that. I cannot agree more. I'm going to use that. I'm stealing that from you. Okay, Dr. Hawkinson, final thoughts.
Yeah, it's great having these guests on. Obviously, a few of our more refined guests that we've had on this show.
Aren't they?
So it's very thankful to them. I think moving forward, we always get questions, or we had gotten questions about what can I do to improve my immune system. Doing those things are the same things that will also help improve your brain health as well. Good rest, adequate nutrition, physical activity, mental activity, all of those things help with not only your immune system, but your body as a whole, and especially your brain as well.
Doc Hawk, thank you. And thank you again to all of our guests and our viewers for being with us today. Have a great day. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. It's not your game face, it's your headspace that matters when you want to stay competitive. I'm Jessica Lovell on the next Morning Medical Update. The first installment of our Women in Sports series focuses on getting your mind game ready. The expert advice from a college athlete and a sports psychologist. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.